So this is an individual that's on the ground here talking about the issues in New York.
Why shouldn't we be hopeful that we can come up with a therapeutic quickly?
Let me tell you the problem right now. Before I came here this morning, I was in the emergency room seeing patients. I still do not have a rapid diagnostic test available to me.
Well, that's easy to do, is it not? Is it hard to manufacture?
It is easy to do for some countries. There are going to be hundreds by middle of the week. There's going to be thousands by next week.
So
and this is a testing issue.
We need to have a vaccine strategy. I think a vaccine is a year or two away. Right. I think we need to think about what we're going to have in the fall to be a backstop to this. Hopefully this will start to dissipate in July and August, but it's going to probably come back in the fall. And then what next?
Well, we have an HIV drug, Kaletra, that we're studying right now. It's in a clinical trial. That information is not going to be available for a while. There are going to be thousands of cases here. We have already moved from containment to mitigation. We are trying to lessen the severity here. You are going to see widespread disruption to daily life. Do not believe the false reassurance. Keep in mind, flu kills 25 to 69,000 Americans, so a very bad flu season.
The panic that has been caused already and the economic effects already much more than twice the mortality rate of the flu. We're at 10 times the mortality rate of the flu.
What do you make of the Diamond Princess? Because I know that's not a typical population, but the case fatality rate there is going to be above 1% probably when that settles down.
Absolutely. And if you're an 80-year-old...
Is that because it's an older population?
So if you're an 80-year-old on a cruise ship, you're in trouble. I mean, the case fatality rate's over 10%.
Well, we have a lot of undiagnosed cases to his point right now. There's probably, low thousands of cases in this country that we now need to turn over the card on. So we're gonna have a surge in cases before we start to catch up to the actual level of spread.
Definitely. We're hearing that life's going to go about just like normal. That's not true. And to speak to the earlier question, I'll tell you, I live in Westchester. When I'm walking around Westchester, not really worried about coronavirus, but when I get on the 6 train, when I'm walking around Times Square, when I'm in the emergency room every single day caring for patients, I am very worried. So we've seen one case in New York. I bet there are hundreds. I bet there are thousands in the United States. And the longer we wait to get testing up and running, the worse this is going to be. But I'm telling you, as a practicing clinician, we're not there to...
Why did I say I thought they were shipping tests to California in bulk? I thought that was the latest.
The testing capacity by the end of this week, so we have about 100 public health labs. They'll have a capacity to do 100 tests a day. So it's at 10,000 tests a day by the end of this week. That still requires physicians like you to call the public health department in the state to order the test. So that's cumbersome. That's cumbersome.
Right. So that's right. So a week or two from now is when we're going to begin getting real information. Right now, we're still largely flying blind. So if you're worried about fear and uncertainty, we're still in the thick of things.
See what Cuomo has to say in comparison now.
First, we're going to speak about the situation that was reported last night with a person who tested positive for the coronavirus. That woman is a healthcare worker. She's 39 years old. She had been working in Iran and came back on Tuesday to New York. As she was a healthcare worker, she was very aware of this situation and the potential for this situation. We don't believe that she was contagious.
There have been a few cases where it seems like the transmission did occur before symptoms started, or the transmission occurred when symptoms were very mild and the person didn't know that they were sick. Now, that seems to be an exception, and the vast majority of people who became ill in this outbreak became ill because they had contact with someone who had symptoms and who was either coughing or sneezing and transmitting the virus in that way.
When she was on the plane, or when she took a private car from the airport.
Okay, so just give you a timeline. This was all early this morning, and the report with the doctor, the interview with the doctor was first, and then Cuomo actually came out and did this statement here.
To her residence, but out of an abundance of caution, we will be contacting the people who were on the flight with her from Iran to New York, and the driver of that car service. The healthcare worker also was with her spouse. They are at home, at their home. The healthcare worker has manifested some respiratory illnesses, but her condition is mild. So the virus, in this situation, the facts defeat fear, because the reality is reassuring. It is deep breath time.
But the key here is do not believe the false reassurance. I'm telling you, the cases are about to surge, and only then can we make informed decisions.
Doesn't that lower the denominator on the mortality?
Absolutely.
First of all, this is not our first rodeo with this type of situation in New York. When you look at the reality here, about 80% of the people who are infected with the coronavirus self-resolve. They have symptoms. The symptoms are similar to what you would have with a normal flu. And for most people, they treat themselves, over 80%, and the virus resolves that way.
Oh, and there's also something called the boomerang effect, which we may be seeing in Hubei right now, which is that places we think are clear are starting to have rates creep up. We may see things bounce back.
About 20% get ill. The mortality rate is estimated to be about 1.4%. 1.4%. What does that mean? The normal flu mortality rate is about 0.6%.
So if we're talking about mortality rate, I see numbers like 1 to 2% thrown around. I don't believe that. The modeling we're using data out of Korea. We think that's the best.
And what is that?
0.2, 0.4%.
So that's twice as bad as a seasonal flu.
Correct. So a very bad flu season.
The mortality rate is uncertain, but COVID-19 does appear to be more deadly than the seasonal flu, and no one has immunity to it.
I get the emotion. I understand it. I understand the anxiety. I'm a native-born New Yorker. We live with anxiety. But the facts don't back it up here. Also, we're extrapolating from what happened in China, other countries.
Witness critically ill coronavirus patients sealed up in body bags while alive. Witness critically ill coronavirus patients sealed up in body bags while alive.
We have the best healthcare system in the world.
The person who tested positive was only the 32nd test we've done in this state. That is a national scandal. They're testing 10,000 a day in some countries, and we can't get this off the ground. I'm a practitioner on the firing line, and I don't have the tools to properly care for patients today.
Excuse our arrogance as New Yorkers. I speak for the mayor also on this one. We think we have the best healthcare system on the planet right here in New York.
We hear that it's coming very soon, but I'm here to tell you right now, at one of the busiest hospitals in the country, I don't have it at my fingertips. I still have to call the Department of Health. I still have to make my case, plead to test people. This is not good.
So when you're saying what happened in other countries versus what happened here, we don't even think it's going to be as bad as it was in other countries.
The message today is that we are hearing from this administration that the risk is low and that things are probably going to be okay. You don't need to change your lifestyle. That's simply not true.